Welcome back at 8:15. Spring welcomes warmer weather and blooming flowers, but that means the season can also be difficult for allergy sufferers. Finding the proper relief can be a challenge, but here to help with some tips and remedies is Dr. Reena Mehta with Uptown Allergy Asthma. Dr. Mehta, good morning. Thanks for being with us.
Good morning. Thank you so much for having me.
So before we talk medicine, let's talk just things you can do every single day to lower how intense the irritation of pollen is. So when you're out, you have to be out and about, sometimes running errands. What should you do when you get home?
Okay, so we are in peak pollen season. I'm sure many of you back home feel this. Yes. And so things that can be helpful. So if you've been outside all day, the first thing you want to do is clothes in the wash, shower. When you shower, wash your hair because pollen does stick in your hair. If you're outdoors for long periods of time, wear sunglasses, wear a hat, protect those areas of your body that pollen can get into. Pets also carry pollen, so if you have dogs that go outside, be sure to wash them more frequently. Also, changing your air filters before and after the pollen season can be very helpful.
Those are really good tips for every single day. Okay, let's talk medication. Let's first talk with nasal sprays. What should we be doing in that regard?
So I know it's really overwhelming when you walk into CVS or Walgreens and you have allergy symptoms. You're like, what do I use? So if your symptoms are nasal congestion, I really like over-the-counter Nasacort or Flonase as a good way to help with congestion. If your nasal symptoms are more sneezing, runny nose, itchy nose, then I really like over-the-counter Astepro. The other name for it is azolastine. Okay. And a lot of times if you have both types of symptoms, congestion and sneezing, you can use both Flonase and azolastine back to back.
What about those nasal, those sinus cleansers, if you will? So the canister I was mentioning to you, that aerosol canister, saline spray, or neti pots, are those okay to use?
Absolutely. So sinus rinses are a great way to flush out the pollen.
Okay.
And so if you are going to use one of the sinus rinses, make sure you use distilled or filtered water. You do not want to use plain tap water. And then you want to fill it in with a saline packet. You want to flush out your sinuses, and then followed by that, then you want to use your nasal sprays like Flonase, because if you do the Flonase first, then you're just going to wash it all out.
Let's talk medication. I know you were telling me there's a hierarchy of potency. That's what you just told me, and on the lowest end, you were saying is Claritin?
Yeah, so when you think about over-the-counter antihistamines, and when I tell people to use antihistamines, is when you're just generally feeling allergic.
Okay.
You have an itchy body, you're having hives, you're having itchy skin, you just overall feel allergic. That's when an over-the-counter antihistamine can be helpful. Xyzal, Zyrtec, and Allegra tend to work better than Claritin just because they are more potent. If you are feeling very terrible, you can certainly use those medications daily. If you feel like you're needing to use it more than once a day because it's wearing off, then that's reason to call your allergist and just talk about a better medication regimen.
Because there are more intense medication regimens, including injections or shots, if that's something that you need.
Absolutely, absolutely. So, when we think about environmental control and medications, those are helpful, but it's like a Band-Aid. It's not making your allergies go away. When you're thinking about a long-term plan, if you are a sufferer of allergies and it's pretty intense, you can do allergy shots as a way to desensitize you to the things that you're allergic to. It's a very effective strategy that a lot of allergists will offer in their
All right, Dr. Mehta, we're at the peak of pollen season, but you've given us some tools to combat it. We appreciate your time.
Thank you so much for having me.